Hello, my name is Misty. I'm the supervisor for the Breast Center with Midland Memorial. 3D mammography, also known as breast tomosynthesis, is an exam that helps us to better see the breast. How that works is if you were reading a book and you had a book with a cover and you were looking through the cover, that would be like a 2D mammogram. You're trying to see through the whole entire book. But with tomosynthesis or 3D, we get to see all the pages in between. So the radiologist gets a better view of all the tissue within your breast, not just overlapping each other. For those patients that do have dense breasts, we also recommend them having a dense breast ultrasound. And what that does is that gives our radiologist a second look, just a second look through that dense tissue, just to make sure there's nothing there. A lot of patients ask, well, how do I know that I have dense breast tissue? So our radiologists, whenever they're reading their first mammogram or the very first time, they give the breast tissue a certain, or it's categorized by 4 different types. 2 of the types are dense and extremely dense. If your breasts fall into one of those 2 categories, we're going to notify you on your letter, the letter that comes after your mammogram with the results. And then you can speak with your provider about whether you think an ultrasound would be a good choice for you. Most patients, they like to have that ultrasound just to get peace of mind. Many patients of ours prefer to go ahead and schedule their mammogram and their ultrasound at the same time for those patients that already know they have dense breast. And we actually prefer that because then we get to look at everything at one time and the patient only has to make one trip. Texas actually has a dense breast law. It's called Henda's Law. So it requires us as a facility to notify you if you have dense breast. So that's why that letter has that information in it, just so you know how to take care of yourself better. As far as mammography, we do still recommend, American College of Radiology does recommend you still have annual mammograms. And early detection really is the key for getting a good diagnosis and catching cancers early. So girls, please take care of yourself. Get an annual mammogram, come to see us at the Breast Center with Midland Health.